Good morning and good afternoon, everyone. My name is Sam Kim. I am a strategic designer in Philips Design.
Hello, everyone. My name is Marie. I'm a service designer.
And here we have one more designer, Nigel. He's also our key project members, but unfortunately he couldn't make it today. So Marie and myself, Seon, will talk about our project, which is about the healthcare on wheels. So the premises of our project is based on, in 2030, healthcare is going to be indefinitely accessible. So today, the Marie and I talk about how the experiences with the healthcare would look like, especially with the autonomous vehicles, as one of the key enablers that liberate us from the static and inflexible current healthcare system. So unequal access to care, which has been always one of the biggest challenges of healthcare for a long time, together with the rapidly aging population, as well as the shortage of the healthcare resources. But looking back, how all of you has been receiving the care services so far, you always has been traveling to the hospital when you need of the healthcare services. So this is actually because the current healthcare system is centered around the hospital instead of you as a patient. But you can imagine that, because of the various reasons, such as geographical disparities, or in other case, healthcare insurances, even at some point, we may be all encountering the mobility problems. And those issues may actually, makes us not really able to access to the appropriate healthcare. Then it will eventually affect your quality of care, quality of life. So that's why our project team started thinking about what if you will no longer need to travel to hospitals, but instead hospital will travel to you. So first, how we see the healthcare looks like in 2030, and we will continue to tell you about our story.
Have you ever wondered, how will healthcare look like in 2030? In a decade from now, we will probably live in a world with infinite access to healthcare. Anyone can receive care at the snap of their fingers. And how, you may ask? Well, in the future, healthcare is distributed. We will experience care through an ecosystem of connected touchpoints. Healthcare extends into every corner of our lives. On our phones, in our homes, in our malls, offices, and even in vehicles while on the move. This is our vision of distributed health. And in this episode, we will explore how care evolves when it goes on wheels. So let's begin. Today we see a continuing and concerning trend of cities building more and more hospitals to meet the demands of their growing population. This may solve the problem for now, but it's incredibly expensive and not at all sustainable for the long haul. So think about this. In 2030, healthcare is decentralized. Hospitals will only consist of crucial elements that require patients to be on site. All other functions will be removed, and it will entirely be mobile in a network of hyper-connected autonomous vehicles. So instead of you going to the hospital, how about the hospital going to you? In a future with autonomous healthcare, what else would you like to see?
So what do you think about this? Are you really with us that healthcare would be very much distributed in 2030? Actually, what you've seen as a kind of our speculation is not really castle in the air. As you can see, this kind of a diagrams, we observe the more emerging trends and market dynamics that already influencing our world, which is driving the distribution of the care. So firstly, we as a people already start recognizing the importance of the preventive care than the sick care. So we live longer than ever, meaning that actually we as also the individuals already start focusing on our post-retirement, which will just start at around the 60 years old. And we are all actually already aware of and also informed about the importance of the holistic approach in prevention for the healthy aging. So that's why the young peoples and also we all actually putting some effort into more like a self-care practices, but also we are recognizing the value of the regular health screening in the early detection of the disease. But together with all those kind of a consumer awareness of the preventive care, our government's also supporting for more and more affordable and accessible care. So as an example, like a government in many countries incentivize the healthcare programs that providing the services in a lower cost outpatient care setting, meaning that in the past, you as a patient, if you want to really receive the surgery, you always have to go to the hospital. And also you need to stay over and then receive the surgeries and then recover in hospital. But in this kind of low-cost outpatient care settings, and then you just find the very specialized clinics nearby your places, and just go there and then receive the simple surgeries and go back to your home and recover in the most comfortable environment for yourself. In a very similar vein, also, U.S. government has already focused on the loosening the restrictions on the telehealth as part of the Medicare program. And then as you can see, like all the government is already fully endorsing more like affordable and like a convenient cares outside of the hospital. Besides those consumer behaviors, as well as the government initiatives, we also observe the technology push. With the technology development, a lot of surgeries, and also the diagnostic procedures now can be performed in a very safe manners in the outpatient setting. And also new technologies like Internet of Things, AI, also big data, all those different technologies are pushing the more healthcare services outside of hospital walls. But, last but not least, we also observed that more and more players entering into the hospital, which is very unconventional players, like the big tech companies or like a disruptive startups already kind of play a very significant role in the healthcare. But the interesting part is that those new entrants are really accelerating the appearances of the new outpatient care model. As an example, like the size is very small, but smart clinics in a very unconventional locations like retails or even the airport. And also there is another care models, online and offlines are fully connected to provide cares towards their own patients pool. And the thing is that all those kind of new initiatives are really disrupting the traditional healthcare business models boundaries. So the more options available to provide or receive the care outside of the hospital, it may also create more demands, also more needs at the same time. It could be definitely the vice versa. So the availabilities, unconventional avenues for the care outside of the hospital, as we mentioned, just retail care as an example, that makes direct-to-consumer markets getting bigger and bigger. So for instance, like a self-diagnostic test, that the DNA test can be delivered at your doorstep and then you immediately received about the analysis about your DNA, not via the hospital, then those are not available actually in the past, but you can easily achieve those kind of services whenever you want. And also the ambulatory care options makes the care models more affordable together with a high demand for the at-home care services. And all those kind of movement is naturally shifting all the core functions of hospitals out of the hospital. So this is a brief overview how we are seeing and illustrating the distributed healthcare landscapes, as you can see here. In this kind of distributed healthcare models, hospitals can be super specialized institution, and patients only travel to hospitals for highly specialized surgery whenever they need it. But as you can see here, there is a care coordination center. This could be the hospital, but there is no bed and there is no patients. And with those care coordination centers fully connected with other touch points of the healthcare across the city, it could be the drone, it could be the autonomous vehicles, it could be the another buildings, but fully connected with those care coordination center. And all those together, actually the healthcare could be more seamless and integrated, and then we receive those healthcare whenever, wherever we want it. So those care vehicles actually play a really important roles within our kind of the stories in here. So together with a drone, it could be the in charge of the real-time medical supply on demand, but also thanks to the autonomous care vehicles, healthcare workforces can be more mobile, and also cares can be provided across the city since those vehicles can be running around those cities at the same time, and eventually all those services can be also definitely part of our daily life. So we as a project team articulate those different types of the scenarios of a new care delivery models, and then let's watch one of them, how daily prevention would look like in the distributed healthcare system.
Have you ever wondered, how will healthcare look like in 2030? In a fully autonomous future, what if you could receive seamless health screening on the go? Here, we have Nicole. On the way, he's empowered to manage her diabetes. As part of her mobile healthcare plan, the healthcare discreetly monitors her status by running vital measurements, all in the comfort of her seat. For example, a biometric eye scan seamlessly measures her blood glucose level. The insulin dosage is then adjusted accordingly and administered by the armrest. She then receives a reminder to top up her insulin subscription as is running low. Wouldn't it be nice if you could enjoy prevention in your daily commute? In a future with autonomous healthcare, what else would you like to see?
So as you've just met Nicole, she's appearing in our first episode of the scenarios that daily prevention on the go. Or as you can see in here, we have more stories in our complete vision video that what if the healthcare workforces can be working as a freelancer with autonomous vehicles will be a mobile clinics. And also, what about when you are receiving the surgery, the preparations can be done in transit instead of hospital. And also the other scenarios, as you can see here, that on the go and in motion instead of really like stuck in a hospital, like receiving it in just kind of a, like the hospital bed. So all those kind of scenarios really telling us that how healthcare can be liberating from the hospital-centric kind of current models. And last but not least, again, that we also seen the healthcare could be definitely the community-based in 2030, meaning that all those equipment and all those kind of services can be based on the sharing model. So all those co-sharing healthcare model definitely making those healthcare more affordable and convenient for a lot of different types of the populations, of course, the city and of course on the global level as well. So all those videos is currently available on YouTube. So please enjoy the complete video to watch more stories in our vision video. So from now on, my colleague will talk about more the interesting stories, like how we achieved these great vision stories as a behind the scene. So Mary, I will take it over to you.
Thank you. Yes, so for this project, we adopted an agile approach.
Mary, I think you're on mute.
Can you hear me now? Hello?
Yes, we hear you, Marie.
Okay, so maybe Seyong doesn't hear me. Okay, I will keep going then. Great, so indeed, we adopted an agile approach, and we believe that it reflects the dynamics of the world that we live in today. Basically, because everything moves fast, as designer, we need to imagine faster. Great, okay. And we define this process, we called it Agile Design Visioning, and we define it with 3 principles. Sorry, I think Seyong still doesn't hear me, so she may not know that I need to switch slide. Okay, great. So 3 principles of Agile Design Visioning. The first one is about fast and furious definition. So here We started with a small team of multidisciplinary designers. Basically, we took the research in all trajectories. We explored really quickly different topics. We came back as a group. We ran some debates so that we could create a list of fictional facts to set the context for our vision. Second principle is narrative-driven exploration. So here, basically, we used storytelling as a way to prototype our story, our vision. We worked on different aspects of the scenario in parallel, the product, the UI, the service, in order to really create an MVP, which is a minimum viable provocation. Basically focusing on the core, reducing the noise, so that we could have bite-sized pieces for this vision, stories that are simple enough to be understood really quickly, but still provocative enough to trigger conversations. Okay, so that's for the process. So you may think this vision is interesting, the process is interesting, but basically, how do we get there? What are the steps that we need to take in order to reach that vision? So here we wanted to present another project, which is an example of one of those steps that we can take in order to achieve that vision. So this project was developed for the Japan market in partnerships with Monet, which is a joint venture between Toyota and SoftBank. And it's about a concept of a mobile clinic that is addressing the challenges of an aging population, as well as providing access to care to remote areas in Japan. So it provides primary care services, such as consultation, examination, in-person services, but also self-services, such as an automated pharmacy and a teleconsultation booth. And this project is currently in pilot in Japan. So as you can see, the vehicle is slightly different from the concept. But again, it's a first step towards reaching that vision. So it's running for 2 years. We have a few statistics to share. So about 6 clinics today are sharing this vehicle in Japan. The pilot is going to last for 2 years, and basically it's about improving the coverage that they have for their patients. About 70% of the target who are elderly chronic disease patients have high mobility issue. So for them, they can benefit from this mobile service to increase the frequency of their consultation, since the consultation is going to them. And 20 plus clinicians also benefit from this service because they have an increased productivity. And they can manage higher patients since they don't have to, they can save time from traveling. Great. So that was a quick overview of our vision for a distributed healthcare landscape. So we see that 4 models are emerging in this landscape since services are moving out of the hospital. The first one is walk-in care. So we also mentioned retail care, anything that can be accessed in community settings. Mobile care, we shared a few examples today when the care is going to patients. And then virtual care, which are care services that can be accessed remotely. And since we have those 3 care models emerging outside of the hospital itself is also evolving towards a new model, new hospital care. So we briefly mentioned the super specialized hospital, as well as a care coordination center. So the hospital is also evolving towards a new model of care in that distributed healthcare landscape. So thank you very much for listening. That was an overview of our vision. So for us as designers, it's really interesting to work on vision projects as a way to inspire ourselves, inspire our peers, generate conversation. And it's also really interesting to work on go-to-market solutions. So we really enjoy working on both types of projects. It's a great balance. If you have any question, please let us know about the process, about the content, anything. We'll move to the Q&A section now. Thank you very much for listening.
Wow, thank you very much, Se-Jung and Marie, for sharing your visionary work with us. It's really, really exciting to see how this will help us deliver healthcare in a more meaningful and impactful way, and also how it fundamentally changes the way we all as an audience consume healthcare in the future. My name is Colette Forma, and I'll be moderating the Q&A session with Se-Jung and Marie. So in case you have any question, feel free to post them into the Q&A panel, and we'll try to answer as many as possible in the given time. For a starter, I love the fact that you spoke about the approach you used to get to this vision. Marie, to you, when explaining the Agile design visioning, you spoke about the ambition to quickly reach a minimum viable provocation. I think this is really interesting. Could you maybe explain a little bit more extensive what this means and how it is relevant to designers in your view?
Yeah, great question. So I think for us as designers, when we work on vision projects, it's easy to spend a lot of time doing extensive research, really grounding the vision, and then really spending time developing it, polishing it, and only sharing that vision when it's almost perfect. But we believe that in our case, it was interesting to reach that MVP, minimum viable provocation, quickly. So we only spent a few weeks to shape that vision at first, because we wanted to expose it quickly. We wanted to collect some feedback so that then we could improve it further. So indeed, we thought it was particularly relevant to reach that MVP, to really quickly collect feedback internally and externally. So internally, we engage with our design business partners, who are the people between the design team and the businesses of Philips. So as a way to make it more concrete, to get some reaction. And we also presented externally at some conference and design events. So we believe for those type of visioning projects, reaching an MVP is a great way to improve the vision even further later on, and to quickly get something that can be exposed and presented.
Really interesting. So quickly have inputs and iterate on your vision. Se-Jung, you spoke about futuristic yet grounded speculations. How did that help for this project? Oh, I'm afraid Se-Jung doesn't hear me either. So then can you elaborate on that, Marie?
Yeah, sure. Sorry about that. Yeah, so indeed, we wanted to present a vision that was futuristic enough that it would be inspiring, but still based on trends and emerging models that we already see today. So that was about finding the right balance. So that's why we really based the vision on societal trends, technology.
Can you hear me, Colette?
Elaborate on that. Yes, now we hear you.
Sure. Sorry about that. Yeah, so indeed we
You go, Marie.
Yeah, sorry, still have a bit of an issue. Yeah, so I was saying we explore trends that we already see today from different perspectives in order to reach a vision that is futuristic. So 10 years from now, it's not too far away, but really based on emerging behaviors, mindset, and trends that we already see today.
Thank you very much. Se-Jung, can you hear me? Not anymore. We keep on having some technical issues, and we're trying to solve that on our end. Until that, I'll just address you, Marie, if you don't mind. So there is a question around what types of medical equipment are on board the Toyota mobile healthcare vehicles.
Sure. So we have some teleconsultation equipment.
Apologies, I'm actually having a little bit of a
keep on having
problem.
some technical issues, and we're trying to solve that on our end.
Yeah, I think she has a bit of a delay, so I will keep going. Yeah, so there is primary care services equipment, as well as teleconsultation equipment that are part of that vehicle.
Okay, thank you so much. Let me see. There is a question around the impact on sustainability. So centralized hospitals versus vehicles moving around the city, and what is more expensive? Is that a question you could answer, or can you share something about that?
Yeah, so I think there is two aspects. There is indeed the cost, but also then the environmental sustainability. But it sounds like the question is more about the cost. I think indeed when we imagine this future, it's indeed important to reduce cost of care. So that's one of the key pillars of our quadruple aim. And that's also why we have those two types of projects. We have the vision, but then we also have go-to-market solutions that are currently in pilot. So that's why it's important to test them, get some feedback, and after a while be able to do an analysis on the cost of care. But since the pilot is still ongoing, we don't have precise numbers yet, but that is something that is it's part of the analysis of this pilot, definitely.
Thank you very much for clarifying that. You mentioned how this concept will be improving population health management for future cities. Can you tell a little bit more about that?
Sure. So actually one of the scenarios, the last one that we briefly presented, was about population health management, in this idea of providing a dynamic response to population health management. So because we have this fleet of autonomous vehicle and because we have a mobile workforce, basically it's more dynamic and it can adapt to changes and even to unexpected changes. So in the case of a virus, for instance, or a natural disaster, the idea is that from this care coordination center, we can really manage this fleet and this workforce in order to quickly respond to those changes. So that scenario was very specifically addressing the challenges of population health management. So we briefly mentioned it, but I would encourage people to watch the video to see it in more details.
Super interesting. Thank you very much. You mentioned the vision serves as a conversation piece to provoke thoughts and having those conversations. So how have you been using this so far?
Yeah, so indeed, we worked on that vision almost 2 years ago now, and then we spent the rest of the time engaging in conversation. So we used it internally, as I mentioned, with our design business partners and also to engage with stakeholders from the different businesses of Philips. We've used it within our design team as well, of course, but we've also started to present it externally at conferences and design events, and we also use it when engaging with customers. So it's really about sharing a vision that is not futuristic but not too far away, and then discuss what are the steps that we can take to reach it, what are the needs that we want to answer, what are the challenges that we want to address. So it's been used in different contexts so far.
Wow, that's super cool. Must be really rewarding to work on a project like this, I can imagine.
Yeah, it's really interesting.
Nice. There is a question around what surprised you most in the pilot so far. Are there any things that stand out for you?
I think. Yeah, I wouldn't. I don't know if anything surprised me yet. As I mentioned, the pilot is still ongoing. I would say, but same that it's always rewarding to get some good feedback about a pilot. But I don't know if I would say that anything surprised me particularly. Yeah, it's still ongoing. So maybe more to come on that later.
Yeah, we'll follow you on that.
Yeah.
related to this question, is there any idea about launching the pilot to other countries, for example, Europe or rural countries somewhere in the world?
Potentially. At the moment, it's really specific for the Japan market. It was developed, as I mentioned, with a local company, Monet. Potentially, it could be developed for other markets, but for now, the focus of the pilot is on the Japan market. But the challenges that we see in Japan with an aging population and even access to remote areas, that is definitely transferable to other markets as well.
Great. How often does Philips commission visionary projects like this? Someone wants to know.
I think it varies, but I would say quite often, because that is still something that we do in parallel to the other go-to-markets project. So I don't know precisely, but it's something that we do regularly on a variety of topics. It could be about our own practice, what should be the vision for our design team. It could be about topics such as sustainability, what's our vision on that, and then it could be on a diversity of topics within healthcare. So I would say, still quite often.
Still quite often. So yesterday we had a talk about the ICU of the future. So we'll have some of those projects, definitely.
Yeah, exactly.
I think we don't have any questions coming in anymore. So my question to you would be, is there anything else you would like to share about this project? Challenges you might have encountered while developing this vision? And can you share that as a final question?
Yeah. I think so. Indeed, as mentioned, we developed this vision end of 2019, so about 2 years ago. And because we had this agile approach, it was a really dynamic project. So in that sense, of course, there are challenges that can come with that. But I think after that, we really try to unfold our process and really try to define it so that it can be replicated later on. So when we first defined this vision, it was super dynamic. And then after all, we really tried to define this agile design visioning project. So the mistakes that we made or the challenges that we encountered, we tried to address them through the definition of this process so that we could reuse it and replicate it for other topics. So I guess we can always learn from our challenges as a way to improve our practice and to make it replicable by other teams.
Thank you so much for clarifying and also sharing your personal story here with us.
Sure.
So I think Se-Jung still doesn't hear us, which is a pity. I wanted to really thank you a lot. And also, I can imagine that people might be interested in joining the team at Philips Experience Design to really make working on the future of healthcare their work. So if that's the case, they can just scan this QR code and sign up for the talent pool and be informed about all the roles we have available in Philips Experience Design. So looking forward to hearing from you. Thank you so much, Se-Jung and Marie, for this sharing session. It's really great work and a very inspiring vision. It makes us all think, I'm sure, and I'm really looking forward to hearing about your next visionary project. Thank you also to all attendees for joining and making this an engaging session. If you feel like listening to our last talk of this week, there is still one on this afternoon, 4 o'clock Netherlands time. So you can still register online and join us there. For now, thank you so much, everyone, and see you soon. Bye-bye.
Thank you, everyone. Bye.